everyone, I'm Berk Karataş. Vasectomy, that is sperm channels in men. The cutting and tying, whatever you want to call it, that's what I'll be discussing. This is almost equivalent to the tying of tubes in women. We can think of it like that. Now, vasectomy is a method that is widely practiced all over the world. For example, in China, 8 million people undergo vasectomy each year, while in the United States it's 500,000. It's not performed very much in Turkey. The reason is that couples usually go to obstetricians when it comes to birth control methods, and instead of urologists, they mostly visit gynecologists, and those gynecologists don't talk much about vasectomy. Birthday? When you mention birth control methods, couples mostly go to gynecologists instead of urologists, and there, the gynecologists don't talk much about vasectomy. The first reason is, secondly, there are some meaningless myths and superstitions among the public. I will briefly talk about those as well. Now, this is the process of tying the vas deferens, or the sperm ducts. We have two tests. The testicles, where the sperm is stored, normally go upwards. It passes through the prostate and exits outside. Now, we tie this part and bring it outside the skin, which I'll talk about a bit later. We cut this part and then we tie it. So sperm isn't continuous. The procedure is easily done under local anesthesia in an office or outpatient clinic setting. It's done easily. One side takes about 15-20 minutes, and the other side takes 15-20 minutes, so it can be done in half an hour. You can get up and continue with your life. It's actually 99% effective, but it's 100% effective. However, due to surgical issues or people rushing what is normally required. So, at least after this procedure, we become sperm-free after 10, 15, 20 ejaculations. Sometimes people rush, and during that time, pregnancy occurs. For these reasons, it has a 99% effectiveness. Spousal approval is important, both ethically and socially. If you have a legal spouse, meaning someone you are married to on paper, they definitely need to signature document. Approval, yes, they need to say that I also approve of this. Because, for example, your spouse is 32 years old and you are 40 and you have 2 children. You don't want children, but 3 years later, your spouse might not want children either. They can clearly express their wishes or make a decision themselves. This is not a situation that married men can decide on their own. It definitely says that spousal approval is necessary. Here, the penis is here, and on both sides there are the sacs where the testicles are. Here, we already have a channel that comes to our hand. We use a special tool called a babcock to make an incision of about 1 centimeter here. Then we tie it off and cut it. That's all there is to it. Yes. Now, there are questions here. One during ejaculation. I had this surgery. Does fluid come out during ejaculation or not? So, first of all, the answer to the question is yes, it does come out. 3 to 5% sperm, fluid from prostate, seminal vesicles. The amount of sperm in it is about 3 to 5% of the total fluid. So, when we ejaculate, from here the sperm comes out, but the main fluid comes from the prostate and the seminal vesicles here. Let me explain it this way. It'd be solid. On average, you ejaculate about 3 cc. After having this surgery, the amount of your ejaculation will fluctuate. So this is not something that can be seen with the naked eye. Therefore, your fluid will continue to come out during ejaculation. Does it cause hormonal imbalance? The answer is no, it doesn't. The testes have 2 main functions: to produce male hormones and to make sperm. These are, yes, directly and indirectly related to each other. For sperm production to be expelled, this channel is necessary, but the testis does not need such a channel for the male hormone to enter the body. It already enters through the bloodstream, which is why it does not cause hormonal disorders. Does it provide pleasure? I mentioned this in last week's video. Among the birth control methods for men, this is the one that increases pleasure the most. On the contrary, pleasure does not decrease, it actually increases. But this is not a procedure done for pleasure, so let's not think of it that way. It simply enhances the existing pleasure because anxiety and worry are completely eliminated. So, what can happen after we undergo this procedure? A hematoma, meaning bleeding, could occur. For instance, if we hit a part of our body, it might bruise. This usually resolves very easily. We take precautions against infection, and we don't see many infections anymore. The issue is sperm granuloma. What does this mean? Now, when we perform this procedure, sperm production continues, meaning sperm is being made here and is coming towards this area. After a while, a lump about the size of a chickpea, sometimes the size of a marble, can form here. Let's call this a sperm accumulation. It doesn't usually cause much pain, and the person can feel it. Sperm production continues, so sperm is made here and comes towards this area. After a while, a lump like a chickpea or a marble can form here, a sperm accumulation. It rarely causes much pain, and if concerned, we can remove it from there, but it doesn't cause issues. We just need to be aware that something like this can happen. It doesn't usually cause much pain, the person can feel it. If someone is really concerned about it, we can remove it from there, but it doesn't create any problems. We just need to be aware that something like this can happen. So, is this procedure reversible? Theoretically, yes, it is reversible, but in practice, it is quite a problematic situation. There is about a 50% success rate. Now, of course, the procedure is very easy. We do it in 30 minutes, we cut and tie, and it's done right away. The person continues normal life. Well, after a month, the sperm will no longer come out. Any urologist can do this, but not every urologist can perform the reversal procedure. This needs to be done by people who are specialized in microsurgery and know what they're doing. The procedure is not done locally. It is done under general anesthesia. It takes about 2 hours. Of course, these are expensive because they are natural. There is a 50% success rate. Generally, after the procedure, there can be narrowing or blockages again within 6 months to a year. That's why it's important to think carefully. If they are married, they should definitely have a conversation with their spouse. Plus, it's important to make a definite decision on the path to not having children. I think there are 2 points we need to know here. When deciding on the point of vasectomy, I no longer want to have children. I have 2 or 3 kids. Well, I'm already 40. It could be 35. It's not very important. Do something, have children. To do something, reaching a consensus and having children, the first thing is this. If that's the case, it can be done at any age. The second thing we need to know is that a vasectomy we'll use it as a method of birth control, but a vasectomy, to us, it doesn't protect against diseases like condoms do. So let's create a scenario like this. You did this and you somehow separated from your partner. You continue with your life, you'll have a new partner. I'm already not going to have a child in questionable relationships. If you don't use a condom in any way, you'll catch a disease. You can catch it. The topics we're discussing here are entirely about marriage, talking about monogamy and having a single partner. In this regard, it's a good method of protection. I mean, it's a perfect method of birth control. But since it won't protect against diseases, you need to be careful about this. Thank you.